Hello everyone, it's Dr. Matt from Swiss Family Chiropractic, and today I was going to go over hip pain. People come in with hip pain all the time, and they usually have questions like, is it arthritis in my hip? Am I going to need a hip replacement? Arthritis in the hip definitely can cause hip pain, and sometimes people do need hip replacements. But the good news is that I would say in our office, from my experience, the majority of people that are coming in, even if they do have a little arthritis in their hip, the pain is not coming from that. It's coming from the muscles that surround the hip. So basically, if you look at this model right here, this is the pelvis, and in the pelvis, in like this kind of caved in area, there sits about 5 to 6 different muscles that are what would be considered like a pelvic stabilizer. Like everyone knows glute max. Well, there's also a glute minimus, there's glute medius, there's your piriformis, there's a few other muscles in there as well. And basically, they can all get irritated from things like exercise, but also from stuff just as simple as sitting at a desk all day. They can develop painful trigger points. And over time, it can show up as hip pain. One of the classic signs that you might have this problem, meaning that it's coming from the muscle, is that if you lay on that side at night, it hurts more. Sitting for long periods of time can make it get irritated. It can get irritated when you're trying to get up from a chair. But yet, walking can be okay, and sometimes running can be okay. So, there's hip pain, but the physical activities don't seem to hurt it that much, then we're pretty sure it's not coming from the joint, and that it can be coming from the muscles itself. Obviously, it can be a combination of things too. Sometimes it can be from the hip joint a little bit. It can be coming from the lumbar spine if these nerves are getting irritated. So hip pain is not as simple as it's just your hip joint. To really get to the root cause of it, you really need to find out exactly what's causing it. That's why when we examine our patients, we're not just looking just at the muscles or just at the spine or just at the hip joint. You have to look at it all to really figure out what's going on so that you can correct it. So if you have any questions, you can always call our office. The information will be on the website. There's also probably a get started button that you can click below. So you can always come in for a complimentary consultation to find out if you think you have some hip pain and we might be able to help you. So have a good day.